Stand is loose. गिरे तो पकड़ लेना. ठीक है. So today's topic is diet and exercise. Why I have chosen this topic, a common topic for everyone. I could have chosen lifestyle. I could have chosen dressing sense, personality changes. Why this? Why diet and exercise? Anyone? You can answer.
Like diet is all about diet and exercise. These are core.
Yes. This is the basis of everything you do. Why are you looking the way you are looking? Or why are you feeling the way you are feeling? Or why are you grumpy on some days and happy on some days? Everything comes down to this. The video is playing or not? I don't want to do itna mehnat फिर से नहीं करनी. ठीक है? So everything, the way you feel, the way you look, the way you are talking, everything comes down to these two things, which we often tend to neglect, isn't it? How much of time in a day do you think about कि कैसे चल रहा है? Do you assess? Assessment कितना time करते हो? Any of you gives 5 minutes to assess कि मेरा diet सही चल रहा है कि नहीं, कि exercise सही चल रहा है कि नहीं? He does, I know. तुम्हारा तो छोड़ ही दो. इसका मकसद रहता है मैं खाऊं नहीं. I'll not eat anything. I'll remain simple. That's the goal. Anyone?
I do exercise. Focus.
You think about exercise, but you don't think about diet. Diet is fine.
No, it's diet.
90% people diet is fine. Then why are you getting so many illnesses? Why is India the diabetic capital? Lipid profile become deranged in almost every person. Why? If everybody will say my diet is fine, ask anyone. I'm eating fine. I'm certainly yes, I'm eating one apple a day.
The common mindset is like if a person looks fit, then he will assume that he is eating or she is eating fine.
Very nice. If you're looking fine, if your weight is fine, we think that our diet is fine. If her weight is, what is your weight? Sorry to ask.
48.
48. 48 है तो fine है. जब 60 लगेगा तो लगेगा उसको मेरा गड़बड़ है. So we basically judge it on the basis of external appearances, on how we look, not on how we feel. ठीक है? तो this assessment every day at least 10 minutes you have to do on diet and exercise. And how I'll first cover the diet and exercise. How do you assess it? For assessing the diet, you have to feel, you have to see 2-3 dimensions. What we currently see is how we look. If I'm looking fine, if my weight is, I'm looking slim trim, then I think my diet is fine, my exercise is fine, I don't need to do anything because I'm looking fine. But you have to also see how you're feeling. I'll tell you about myself. I'm looking fine, maybe a little tired, but I'm feeling very tired these days because I'm not getting time to think about this, because I'm thinking of you all. Getting it? So this area is getting compromised. That happens to most of the people. Most of the busy professionals, students, almost everyone compromise on this thing. How are you feeling? But this is also related to diet. So, and third thing is your energy levels and your blood parameters. We never test for this. These days people are aware, so they check their vitamin D levels. But once in a year or once in 6 months, you should get your blood parameters done. Who knows you are calcium deficient, or maybe you are D3 deficient. For that you are feeling tired, and then you are taking prescription for depression, but actually there is a D3 deficiency that is making you tired. Getting it? So blood parameters are important. Your energy levels, your feeling, your look, how you are looking, all these things. In terms of looking, I am not telling you should look beautiful or this. Are you looking fresh? Are you looking like you have sufficient nutrition in your body? There is no anemia, there is no pallor. You know, anemia is like when you feel like this is pale. A lot of girls, most of the girls will have. And blood parameters, one is important is hemoglobin. What is your hemoglobin?
11.5.
Very good. I have no idea. She is more advanced than you. You should always know your hemoglobin level. Why? Because iron deficiency is the most common cause of low energy. Hair fall. समझ में आ रहा है? हाँ? ठीक है? So all these things, all these parameters you have to see when we are talking of diet. So what decides what diet we have? What I am currently taking, what decides? तो आज क्या खाओगे, क्या कौन डिसाइड करता है, क्या डिसाइड करता है?
At this point, it's just my mood, I think.
Yes, very good. That is the answer I wanted to hear. It's mood. Your mood decides your diet, and then your diet decides your mood.
Yeah.
This is a vicious cycle. Getting it?
Okay.
It should be a cycle. This is a cycle. Sorry, I drawn it in a straight line. So mood decides your diet, and then your diet decides your mood. And not only mood decides your diet. If you are in hostel or if you are a dependent person like me in terms of food, it's availability. I never cook, so whatever is available at home, जो जिसने खिला दिया, ठीक है? Availability, mood, the place you are staying in, all these things. So the point is that our diet is not a conscious choice. We are not consciously taking our diet. आज क्या खाओगे तुमने डिसाइड किया है? No. Whatever is in the hostel, is at home, where is? और इसके लिए तो मूड ही है. आज मूड किया है चिप्स खा के सोऊंगी. ठीक है? That decides our diet. So we are not consciously deciding our diet. And our diet is deciding our mood. Then you will ask, come and ask, ma'am, why I feel so grumpy all the time? Because you are not taking care of these factors. है ना? तो अभी हम इस साइकिल में कहाँ इंटरवेन कर सकते हैं? You want your mood to be in your control or control of other factors? Obviously in your control. That is the only thing you want to be in your control first. So where will you bring the control?
We should understand the needs.
Yes. What your body needs is very important. This is that you give in terms of diet. Okay, so what your body needs basically? अच्छा, I'll tell you why diet decides mood. इसमें पूछा नहीं, पूछना चाहिए था. खाने से क्या है mood का? क्या है?
Then our body reacts with the nutrients.
There's something known as neurotransmitters. I told you all. Neurotransmitters. They reduce in depression, in anxiety. It's not as simple. It's a complex pathways are there. I'll show you the chart. This you see, the neurotransmitters are secreted. I've shown you all this photo. ये न्यूरॉन से न्यूरोट्रांसमीटर्स निकलता है. ये बनेगा कैसे? बनेगा कैसे? और suppose hormones is a more common term. Okay, hormones is a more common understanding. बनेगा कैसे? Nutrients, protein, amino acids. ये आएंगे कहाँ से? अपने आप तो पैदा नहीं होंगे ना बॉडी में. So whatever you are eating, ultimately that is creating these things for your proper functioning of the brain. है ना? खाने से ही ना है protein, amino acids, all this, and then they are being converted to neurotransmitters, hormones, to something known as protein synthesis. सब लोगों ने पढ़ा होगा biology में. Yeah, please come in. So she is the badminton state champion. Bus is late. It's okay. Come on. Take a chair. देखिए. You can turn it this side. Okay, so I'll just sum it up for you. We are focusing on diet. You would like to sum it up for me, anyone?
Here we
Yeah.
are talking about diet and how it affects our mood and exercise.
Okay, so you are an athlete. So you are a little bit ahead of all of them, I guess. So I thought you would come and teach 10 minutes ahead. It's okay. So diet and exercise is something that determines your performance. Okay, for you. You said yesterday my performance is reducing. Why? Maybe you are not focusing on the diet and on the exercise. Okay. So we are discussing that what decides your diet. So food, your mood decides your diet. आज ये मन किया खाने का, or the availability, or the places you are stuck in, you can't do. So that decides your diet, and then your diet decides your mood. Getting it? Why you are feeling low, that may be related to the diet also. And why diet decides the mood? Because there are something known as neurotransmitters and hormones that are required for the proper functioning of the brain, that are made from the protein and amino acids to diet से यार. So that is the reason we need to focus on our diet as much as possible. Is it? This is what I have learned till now. Now, Anusya will tell me that what is the diet one needs to have in a day. Not your diet, what one should actually have. He has 2 chips in a day.
No, I don't think so.
Healthy. Banana chips in a day. Okay. So what one should have? You would like to tell? As an athlete, what one you should have in it?
Protein होना चाहिए.
Very good. The first things he knows is
Carbs भी होना चाहिए.
yes. Proteins. Carbs. Yes.
Vitamins.
Very good. Vitamins. What else?
Fat and fiber.
Very good. Fat you should not miss. Fat को सब लोग दुश्मन समझते हैं. It's not. ये जो न्यूरॉन बनता है ना, इसका जो माइलिन शीथ बनता है, वो फैट से ही बनता है. Fat is very important, but you should know the right kind of fat and the quantity. ठीक है? What else?
Fiber.
Fiber. Very good. People already know everything.
Calcium, zinc.
Let's put it under electrolyte. जो बचा calcium, this, that. ठीक है? तो there are very complex calculations that ये कैलोरी, वो कैलोरी, इतना खाना चाहिए, उतना खाना चाहिए, वो किसी को समझ नहीं आता ना किसी को याद रहता है. So we will understand the basics. वो सब कैलकुलेशन में ना हो सके. ऐसे तो बहुत लंबे लंबे कॉम्प्लेक्स कैलकुलेशन होते हैं, but we don't need that. So basically you will see कि प्रोटीन हमको मिलेगा कहाँ से. Yeah. Your name?
अंशिका.
अंशिका. प्रोटीन कहाँ से मिलेगा?
Eggs से मिल सकता है.
Very good. Vegetarian है.
Tofu.
Come on, give some.
Dal.
Dal.
Soy products.
Tofu से मिल सकता है.
Tofu, paneer.
Soya.
Keep on going. Yeah, this is the most important segment we are covering actually. बाकी सब चलेगा. Yeah. Come on.
Whey protein.
Huh?
Whey.
Very good. I wanted to listen it. Whey protein. What is whey protein? अनुष्का को पता है? हाँ?
Protein
अभी
powder.
वीडियो में तेरा नाम ज्यादा आ रहा है, लोग ढूंढेंगे फिर अनुष्का कौन है?
Protein powder होता है.
Yes, protein powder. Whey क्यों नाम पड़ता है इसका? ये मिल्क से बनता है.
Milk.
ठीक है? तो these are all the sources. ठीक है? Eggs, tofu, paneer, dal is very common in India. People think dal में protein है. Very less.
Very less.
Unfortunately, but very less.
Hardly 2 to 3 grams.
Very good. कुछ नहीं है दाल में. दाल में है प्रोटीन, but that is not at all sufficient for your body. If you are saying I am having a lot of dal, I am having a lot of protein, that is bullshit. बहुत लोग गाली देंगे सुन के, but that is the reality. ठीक है? Eggs, the best, easily available. Whoever are non-vegetarians, easily available. है ना वो? If you are not comfortable with the college beach वाला part, I tend to call it cholesterol, but it's not exactly. You can have it in between also, but egg white is the best. Then tofu paneer उससे कम. Then दाल का तो I can't guarantee you. Soya is okay. Whey protein I'll come to the last because it's very important. Nobody said chicken. You all are vegetarians क्या? You are vegetarian. You have chicken.
Chicken.
I am not a promoter of vegetarian, non-vegetarian, but believe me, animal protein में जितना तुमको डायरेक्ट प्रोटीन मिलता है वो प्लांट प्रोटीन में कभी नहीं मिलेगा. It is scientifically proven. Go and search the articles. है ना? Leaving the morality behind, it is scientifically proven that animal protein 1 ग्राम में तुम्हें जितना मिलेगा उसके लिए तुम्हें 500 ग्राम खाना पड़ेगा प्लांट प्रोटीन. Getting, if I am having like 1 ग्राम बहुत कम हो गया, half kg, सोचो half kg या 250 ग्राम of chicken if I am having, जितना मुझे मिल रहा है उसमें प्रोटीन, उतना इक्विवेलेंट प्लांट प्रोटीन खाने के लिए मुझे कितना खाना पड़ेगा? 5-6 times, जो कि पॉसिबल नहीं है. Getting it? So always, if you are a non-vegetarian, it's good for you. Rely on animal protein. ठीक है? There are articles I'll send you, है ना? And I can give you references, but then it will be too ठीक है, तो नॉन वेज प्रोटीन्स एंड नॉट दी रेड मीट. रेड मीट का क्या होता है, प्रोटीन के साथ साथ बहुत और भी गड़बड़ आ जाता है, तो कोलेस्ट्रॉल ये. ठीक है, तो चिकन इज नॉट लाइक कि बटर चिकन नहीं खाना जाके, बॉइल्ड चिकन, गेटिंग इट, बॉइल्ड चिकन एंड एग्स, tofu, paneer, soya. But then somebody is a vegetarian like him, that's why he don't whey protein. You can't have this, so there is a supplement, whey protein, which everybody must have. क्योंकि तुम कुछ भी कर लो, तुम्हारा बॉडी का प्रोटीन रिक्वायरमेंट नहीं मीट होने वाला है with your normal diet, the kind of diet we have these days. The body's normal protein requirement will not be.
Because animal protein is complete protein. All amino acids are there.
Yes, very good, very good. But then everybody can't have it, and it's not possible to have it daily. So whey protein is the answer. Okay. What will whey protein do? Do you have whey protein as an athlete?
No.
You have it. What do you have? Can you tell others how to have it?
वर्कआउट के बाद एक स्कूप में.
Okay, that's our way of using it. Your way of using it?
Same. Whey protein and creatine.
You take creatine. Creatine it is little complex. We'll discuss it later. But whey protein you are taking. You guys are new to it. Okay, you can start with it. है ना? What will whey protein give you? It will give you more strength, more energy. है ना? You look more beautiful. वो ज़्यादा better है. ठीक है? And it will give you more stamina. Basically, it will meet the protein requirement of your body. तो क्या होगा? प्रोटीन रिक्वायरमेंट मीट होगा तो यू विल नॉट ऑलवेज बी ग्रम्पी, हंग्री, जो हम इससे भरते हैं कार्ब्स से. ठीक है, तो द करेक्ट वे ऑफ यूजिंग वे प्रोटीन इज एनीवन?
Just water.
जस्ट वाटर. या वाटर इज ओके. एनीथिंग? व्हाट शुड द टाइम बी?
It should be before dinner.
Before dinner. Okay. I would recommend you woke up. This is the first thing you can take. This is the first thing you can take so that तुम्हें already your stomach is full and you will not feel like having a heavy breakfast and all that, and then you can after 15-20 minutes go for a workout. So most of the top performers do this. They wake up and the first thing they take is the protein.
हाँ, मतलब जब early
You
morning.
getting the concept?
हाँ.
Because that time you are hungry, most hungry. Your blood glucose is more low. We tend to eat तब क्या खाएंगे? उपमा, पोहा, इडली, पूरी जो मिल गया. ठीक है, तो उसको अवॉइड करने के लिए if we take this, the hunger comes down, the craving comes down, the energy level जो हमें एक boost of energy that you need, that comes down. So this is the correct way. Even you can have it in the evening, empty stomach. It's usually advised. Before or after is a choice, but before is better always.
Actually, for me, it is giving good recovery.
Okay, you can customize it, but usually for the newcomers who are starting, before is always better. Before exercise, half an hour before exercise. You're waking up and you're going for a walk before that can happen. Okay? That's the way. So now if you do this much, your protein requirement is met. If your protein requirement is met properly, फिर ये सब अपने आप ही adjust होने लगता है. ठीक है? When your stomach is already full with that protein, say, you will not feel like having carbs. ठीक है? Are carbs bad?
No.
Are carbohydrates bad?
Enough is bad.
Huh?
Enough is bad.
Enough is bad.
Like
More is bad. You
More
are
is
want to say. Yeah, more is bad. But how much should we have?
sorry.
This how much is not decided. This how much. There are calculations to calculate it according to you. But इतना तुम एक एवरेज मानो जितना मैं प्रोटीन खा रही हूँ उससे थोड़ा सा कम या उसके बराबर होना चाहिए, उससे ज्यादा नहीं होना चाहिए.
हाँ.
Getting it? If you are having a, हम लोग तो ओडिशा में ऐसे खाते हैं राइस प्लेट में पूरा भर. Who belong to ओडिशा properly? ना origin ओडिशा किसका है? You are come from outside. You? असम वाले खाते ही नहीं.
खाते हैं.
You are
UP.
UP. सब बाहर के हैं.
Hey, actually, origin
तो
Odisha
you
है,
have
but-
been staying here ना, तो हम लोग यहाँ राइस कैसे खाते हैं?
हाँ.
What is this?
कौन सा पेला?
What is it?
पखाड़ा.
पखाड़ा.
I would eat.
It's very good. You should eat.
Ferment.
It's a sedative.
खाया है मैंने.
Yes, क्योंकि इसमें fermentation हो जाता है तो it's good. Actually, people think this is bad, but this is good.
Probiotics ज़्यादा है.
हाँ, very good. Probiotics. You should also try. It's very tasty.
It's called poita patil.
हाँ, yes. That is good. But then the problem is not in this. The problem is in the quantity.
Quantity.
इसका मतलब ये नहीं पूरा भर के खा लिया. Even the rice plate. The problem is not the rice. The problem is always the quantity. Okay? When you start eating the right proportions of carbohydrate, people around you will be telling, "अरे खा नहीं रहे हो," but actually you are eating the right proportion. From last year, when I intended to participate in Mrs. India, when I became more, I already knew all these things, but I began researching more. I became more aware. I had my trainer. So when I started eating in right proportion, people are like, "अरे तू कुछ खा नहीं रही है." ये वो कितना होता है प्लेट में? इतना बस होता है. That is the right proportion. बाकी क्या भरना है फिर प्लेट में? इतना राइस लेके आओगे तो लोग ऐसे देखेंगे, जान कुछ खाने नहीं पतले होने के लिए, लड़कियों को ज्यादा ट्रोल करता है. ठीक है, तो क्या भरोगे? All the vegetables, whatever the protein stuff you have, eggs, paneer. Suppose you are going in a buffet and there are many people around you. How will you feed your plate that nobody will feel that you are not eating? पहले बहुत सारा cucumber उठा के रखना, फिर साइड में थोड़ा सा राइस छुपा के, and then if you have a पनीर का सब्जी और चिकन, सब्जी इतना भर दो कि लोगों ने बहुत खा रहा है. ठीक है, and what else? आधा प्लेट पापड़ से भर दो, प्लेट कवर, कोई टेंशन नहीं लेगा. You come with this much of rice and little bit of dal, everyone is like, देखो, preparing for the Mrs. India, not eating anything. है ना? So this is how you fill your plate. Even at home when you are filling your plate, है ना? half of the plate पूरा veggies से भर दो and eat that first, so that this thing इसका requirement ही कम हो जाए. You don't have to fight with your cravings. You don't have to fight with your body. You have to go with it. तो कैसे चीजों को ऐसे हम modify करें कि we are also satisfied and our body requirement is also met. Clear on this? Anything about vitamins you would like to tell?
Dry fruits.
Yes, good. Anything? Come on, I want more answer from you. How do you know that as an athlete your vitamin requirement is met?
मैं ऐसे तो मतलब विटामिन की टैबलेट्स लेती हूँ.
That is what most people do these days.
Even I am taking tablets.
Tablets. You?
I have no idea what food it is.
Very good. Then this class is for you
Yeah.
mainly.
Omega 3.
Very good. It's not a vitamin exactly. It's come in the fat range, but yes. Yes. अरे इसमें तुम लोगों ने मेन चीज छोड़ दिया यार. Come on.
Fish.
उड़ीसा में रह के
ये
fish
complete
तुम
है.
बोलोगे कैसे?
कोई फिश खाता है तो उसको
Fish is the
जरूरी
best,
नहीं है.
better than chicken, better than mutton, better than anything. Fish is the best.
Best.
Okay, because fish में कोलेस्ट्रॉल नहीं है, वो नहीं है, वो तुमने वो एनिमल को मारा वाला फीलिंग भी कम है फिश में, है ना? तो fish is the best. कैल्शियम है इसमें. It's the best thing you can have. इसे मुझे ओमेगा 3 से याद आ गया. अभी हमें ओमेगा 3 क्यों खाना पड़ रहा है? Because you are not taking fish in the adequate amount. Basically ओमेगा 3 आया कहाँ से?
Fish oil.
Fish oil.
Fish oil.
In Odisha, we eat the fish and the fish oil also. If you have the vegetarian. Anybody has eat that fish oil का वो बनता है, पकोड़ा बनता है? No one, no idea. It's okay. So try to have this. Whenever you are eating out, you have the option of chicken, fish and mutton. Try to opt for fish. It's the best. ठीक है? फिर ये ओमेगा 3 की गोलियां तब भी खाओ तो चलेगा, but requirement कम हो जाएगा. ठीक है? So these days vitamin, I am feeling very hot. These days जो विटामिन का जो हमारा है कि सबको लगता है कि हम let's take the supplements. It's easy. But do you actually know कुछ supplement में वो है कि नहीं? How do you know? What supplement do you take? Which brand?
Apollo का omega 3 fish oil.
Do you know actually omega 3 इसमें है कि नहीं? How will you know? Amazon, Nykaa, सब ने भर दिया है विटामिन supplements. There are gums, there are this, that. कैसे पता चलेगा?
Blood test.
Good. Blood test में omega 3 लेकिन नहीं आएगा.
Vitamin B12.
B12 आएगा, D आएगा, जो basic parameters उनका. So get a blood test done in every 6 months or 1 year to know the parameters. And then whenever you are taking any brand, consult with your doctor. There are medical brands and then there are commercial brands जो Amazon पे मिल जाता है Google करने पे. Calcium D3, probiotics for women. There are a lot of brands. You have to do your own research. है ना? Because a lot of brands do not deliver what they promise. Sadly. ठीक है? And people spend a lot on this multivitamins these days. ठीक? Are there other questions? I don't know. ठीक है? फाइबर देखिए बस चलिए अपॉइंटमेंट में हाँ 10 minutes time you want to sit inside you can sit you have a chair कहाँ देखते हैं इतनी कहाँ है हाँ what we are discussing fiber ठीक है नो विटामिन का ये हो गया कि either you take get your test done take supplements or if you are eating properly then you may not need supplements also individually you have to discuss it with your doctor in whatever time so fats का ऐसा है कि not all fats are bad little bit of requirement of fat is required so जो मक्खन लगा के खाते रोटी में उनको ऐसे भी नहीं देखना है मक्खन खा रहा है it's required little bit of is required but then it should not be excess कि रोज बटर चिकन खा रहे हैं है ना पूरा भर भर के वो खा रहे हैं वो सब नहीं होना चाहिए it should be in proportions fiber
Green veggies.
very good and fruits very good what else I keep traveling I don't have time to cut fruits and eat what will I do
Makhana.
Makhana. Good what else the very common thing you all are missing इसबगोल का नाम सुना है साइलियम हस्क
Isabgol.
You have listened about it? No, isabgol. Psyllium husk कहते हैं उसको. Chia seeds.
Yes.
These two are very good. You can carry it in your bag. You can carry it everywhere. You know? Try to at least incorporate any of it. ये या ये. Any of it. That is what I do because I don't have time कि इतना मेरा रूटीन सुनोगे तो चक्कर आ जाएगा सर. उन्हें इतना ज्ञान दे रहे खुद कुछ नहीं कर रहे हैं. ठीक है? So try to incorporate either isabgol or chia seeds in your diet any time of the day. Better to take with warm water at night so that you will get a proper bowel movement in the morning. ठीक है? Then ये क्या है electrolyte? इसके लिए क्या बनता है?
ORS.
ORS. But do you need to take ORS daily?
लोग
You
मैच-
might need it after playing.
हाँ.
ठीक है? After a intense workout.
हम लोग को तो डेली सेशन में बोलते हैं कि ORS.
कौन बोला?
बोलते हैं कि जब मैच के बीच में टायर्ड हो जाओ तो ORS.
Who told you?
There
are sports drinks for it. There is a difference between a sports drink and an ORS. ORS is a medically grade formulation for somebody who is dehydrated. You are not dehydrated. Why will you take ORS daily? Getting it? Get sports drink. कहाँ मिलेगा? Come on यार.
मेडिसिन शॉप.
Decathlon. Listen to what Decathlon. Decathlon सुना है? है यहाँ पे. वहाँ पे जाके 10
गेटोरेट भी फिर होगा ना
ठीक
स्पोर्ट्स
है.
ड्रिंक तो
क्या होगा?
गेटोरेट.
हाँ, you can order it online also, but from where I get it, I am telling you. So this is very good before workout, after workout. You are playing a match before that you want some energy. When we are in pageants, we are not getting time to eat or drink anything. The schedule is so hectic. तो बीच में क्या करना है? Sports drink पीना है और protein bar खाना है.
हाँ.
There are two things you should always have in your bag. Protein bar. And there are some mixed bars. जिसमें वो ग्रैनुला होता है, ग्रैनुला बार्स. ठीक है, this is something you should always have in your purse. Getting it? Why? Sometimes your schedule is like that you are not getting time to eat. So that time these are the savers for you mainly. You should always have this. मैच के ब्रेक में इंटरवल में you are feeling drained. Then have आधा प्रोटीन बार या ग्रैनुला बार. You can have a little bit of sports drinks. ठीक है? ORS you can have once every 4-5 days. Because that's a very medically graded formulation that you don't need every day. ठीक है? इतना clear है? Diet is clear. Any more doubts you have, you can always ask in the personal session. Ultimately, diet has to be customized for every single person. But this is the basics every one of you can do. ठीक है?
Is there anyone in nature like who can customize this?
I will customize it for you. Why do you need another person? I am a certified mind valley coach. I coach people internationally for these things. Hollow body coach. Search करना चाहिए. You have not gone through my profile properly then. Hollow body coach क्या होता है? Mind valley का hollow body coach. ठीक है? Go search it. So, as I said, diet and exercise. solves your 70% of problem. You would be astonished. 70%, Anushya. You're ignoring the 70%. Then exercise. बचा कितना? 20%. 10% तो luck भी है ना यार. There's 10% luck in everything. She's having a hard time to accept the luck. Huh? It's okay. ठीक है. So exercise is only 20%. पर हमारा पूरा ध्यान कहाँ है? Exercise. क्यों? क्यों?
Influence.
Influencers. Very good. You're giving very nice answer. Next time you will take the class. ठीक है? वो जिम का रील डालने में जो मजा है ना, वो वेजिटेबल काटते हुए वो मजा नहीं है. It looks so powerful. Oh my God, I'm unstoppable. ऐसे करते हुए. Getting it? That is good, but that is only 20%. पहले पूरा डाइट का पूरा ठीक से करके जाके वहां अनस्टेबल का रील बनाना है. ठीक है? Now coming to the exercise, just tell me briefly. Will not take much time. It's already late. तो एक्सरसाइज में मुझे बताओ briefly what basic concept do you have? When I say exercise, what comes to your mind?
A strength.
Strength. Very good. Strength. Which I don't have. Then? Workout. इसी में आ गया. Stamina. Yeah.
I don't like if it is true or not, but when you start building strength, then it is automatically boosting your confidence as well.
I think mental regeneration sometimes.
Yes. उसी में आ गया. Strength.
Skills.
Yeah. What part are you missing here? So basically, what do you have in your body that gives you strength? Muscles. Muscles. But then who will give the strength to the muscles?
Glucose.
Glucose कैसे आएगा muscles के पास?
Store होगा like
नहीं आएगा कैसे?
daily basis पे.
Blood से आएगा.
Blood cell.
Blood flow. यानी कि cardiovascular
Cardiovascular.
efficiency. ठीक है? Cardio. To call it in general language. Your heart should be pumping blood efficiently so that the blood will take all the strength to the muscles ना. नहीं तो कैसे होगा? How will the muscles have the strength? The nutrients. ठीक है, तो basically our exercise is divided into cardio and strength training. सारे लोग यहीं फंसे हैं. बहुत सारे लोग. क्या कर रहे हो एक्सरसाइज में? हम छत पे चल रहे हैं आधा घंटा. Have you heard this or not? Who is doing it among you? सारे सेशन बंद आगे से. कौन छत पे चलता है आधा घंटा फिर उसको एक्सरसाइज बोलता है?
I do it before sleeping.
That is normal. That is your sleep hygiene का part. इसको इसका to lightly walk. ठीक है? So cardio. Somebody is telling I'm walking for 30 minutes. I'm running for 30 minutes. These all are very good for your cardiovascular efficiency. Or you are saying you are cycling. Cycling, walking, running, treadmill. All this come under cardio. But if you are doing only cardio and you are not doing strength training, that is of no use. Or if you are doing only strength training and you are not doing cardio, that is also a problem. So you need to divide your exercise days into a proportion of this and this. Okay, so at least 2 to 3 sessions of strength training in a week and 2 to 3 sessions of cardio. Why people rely more on cardio?
It's easy.
It's very easy. Treadmill पे जाके चल लिया, how I'm done for the day. But your body is not done. It needs the strength, the stamina. ठीक है? तो कार्डियो सबको पता है क्या करना. I don't need to teach you. You will run, you will walk, you will do anything. ठीक है? Strength training में क्या करना है? This is more important. Yes, strength training. फटाफट. You as an athlete, what do you need more? As a badminton player, what do you need more? What do you think you need more?
Muscle strength.
You need both. बैडमिंटन में दौड़ भाग नहीं करोगे. सांस ऐसे से होता है. क्यों होता है? cardiovascular efficiency. You need to work out. I'll tell just 5 minutes on strength training because cardiovascular you all can do. Okay? Strength training. Even I am very poor in it. But I can teach.
Strength training is very underrated.
Yes.
It's only preferred
More
to
underrated among females.
That you
लोगों को लगता है strength training is more for males. वो उठाना,
सबको चाहिए.
ये करना, डंबल उठाना, it looks more male than feminine. But strength is more required for females. That is more lacking in the females. है ना? तो strength training में क्या करेंगे? फटाफट 3 चीजें ज़्यादा नहीं. You tell me. What do you do for your strength?
For leg strength, squats.
Very good. I wanted to hear that. Squats.
Lunges.
Lunges. Good. Anything
Band
else?
strengthening. Bands.
Bands.
Low
Good.
bands.
सब बता दिया सर.
push up.
Push up. Yes.
सबसे easy है dips बेड पे बस हाथ रख के.
So any important thing you are missing?
Agility.
Part of it, yeah. कौन कितना मिनट कर पा रहा है? किस चीज में कंपटीशन होता है?
Planks.
Planks. Everybody is missing it, but it is the most important thing.
She's one.
अगर इसमें से कुछ भी नहीं कर पा रहे हो और सिर्फ ये कर रहे हो, then also you develop your posture. ठीक है? अनुसार सबके ऊपर से सब जा रहा है. Don't worry, I'll teach you. ठीक है? ये 3-4 चीजें हैं. ज़्यादा नहीं. हाँ? Yeah, then you can add to it. I'm telling you the basics. You can add to it as per your own requirement. It will not take more than 30 minutes. 30 to 40 minutes to have a session of strength training. I have been trained by one of the best trainers who was a triathlon winner during my pageant. The last year ka, you must have seen in my Instagram. So after that I started doing it. Even I knew it, but I wasn't also doing it. It is so underrated. So you should also start doing it. You are already doing it, but you have a back problem, so you have to customize it also.
हाँ वो
ठीक है?
recover हो चुका.
You both of you. I need videos of planks, squats, lunges. लिख लो. ये 3 वीडियो मेरे को कल तक आने चाहिए.
Ma'am, calf raises.
Yeah. Calf raises, everything is an addition. Calf raise, abs. This is endless. Strength training का 4 घंटे का लेक्चर होता है.
Actually वो schedule कर देना चाहिए. Like मेरा क्या होता है Monday, Thursday and.
You are on the right track. See the athletes से do. तुम दोनों के लिए to begin सबसे easy क्या है? नहीं, बैक सबसे मुश्किल है. लगता है easy है वो देखने में reels. You do planks, very good. Planks and squats. ठीक है? How will squat benefit you?
Thigh muscles.
Yes.
Glutes muscles.
Yes.
Hamstring.
You look more toned. You look more beautiful. ठीक है? तुम्हारा body में strength आएगा ना, you that the different kind of glow will come. Athletes have that confidence, that strength, है ना? It comes from squats, lunges, bands थोड़ा आगे का है. For you too, I want you squats and planks. ये दोनों करके मुझे वीडियो चाहिए. कल परसों का. Then I'll tell you if you have done it correctly or not. YouTube से देख के करना. Then I'll correct it. ठीक है? Anything else? We'll take 5 minutes for question and answers. I don't want to overload. Yeah. Any question answers you have? My video is on?
Yes, record.
Okay. Any questions?
I think for me it's just convincing myself to do it, like eat better
That
or
is the most difficult
exercise.
part. That's why there are psychiatrists.
So how do I get myself to do that?
Yeah, so I'll have a session with you. How do you motivate? Basically, this is asking the most common question that people ask. वो सब तो पता है मैम, ये सब ज्ञान तो मुझे भी पता है, लेकिन करना कैसे है? मतलब how would I push myself to get up from bed and go to the gym or do workout at home? I don't go gym, I work out at home. वो जरूरी नहीं है, but whatever you do, you need to मतलब उठ के मैट तक तो जाना है ना, वो मोटिवेशन कहाँ से आएगा? But then you have to remind yourself of the benefits that you will get from this. You have to visualize your that form कि मैं 5 साल एक्सरसाइज करने के बाद कैसे दिखूंगी और अगर मैंने नहीं किया तो मैं कैसे दिखूंगी. For you, you can visualize you can visualize yourself winning matches if you do this correctly, and if you don't do this, यू कैन लूज. कॉन्ट्रास्ट थिंकिंग बोलते हैं उसको. ठीक है, तुम्हारे सामने बटर चिकन रखा है. नाउ पीपल, व्हेन आई वेंट फॉर वेस्ट इंडिया लास्ट ईयर, आई हैव ड्रास्टिकली चेंज्ड माय डाइट. तो लोगों तुम कंट्रोल कर कैसे रहे हो? इट्स वेरी इजी. I see two images in front of me. On the right side I see if I eat this, how will I look, how will I feel. On the left side I see how will I look and feel if I eat this, if I don't eat this, if I eat this. ठीक है, तो contrasting images तुम अपने माइंड में लाना. सुबह उठा, अभी दो इमेज लाओ माइंड में कि अगर मैं एक्सरसाइज करी तो आई लुक दिस. यू कैन ऑल्सो हैव अ डिटेल्ड विजुअलाइजेशन कि लोग मुझे ऐसे बोलेंगे इफ आई डू दिस, I'll be complimented, I'll feel like this, I'll do like this. एक detailed story you can imagine. है ना? You can imagine a photo or you can imagine a story. Depends on your creativity. ठीक है? तो that will, वो एक मिनट में तुम्हें पता चल जाएगा कि भाई मैं क्या कर रही हूँ. That is the technique I use and I have recommended it to most of you. Contrast thinking, contrast visualization. ठीक है? So use that and tell me.
It is just shifting your dopamine. That's it.
Yeah. And once you start doing it, you get into an habit of it. Okay, it's just the starting part that is difficult. Once it gets in your routine, then it's easy. Okay?
I don't know about guys, like when we sweat, we feel that confidence that yes, I did
For
this.
guys, it comes little easy than for females, because our society has trained females not to look strength, not to look our society has not trained females for strength, they have trained it for beauty. So we will spend half an hour on the makeup, but actually if you spend that half an hour on the exercise, you will look more beautiful even with a little bit of makeup. Getting it? How the industries, the commercials are shaping our ये कि highlighter लगाना है, foundation लगाना है, और क्या करना है? Come on. Mascara. और contour, very nice. What else? Eyebrow pencil. कितना टाइम लगता है सब में?
That depends actually.
It depends on the mood. If I'm going for a party, it may take 1 hour. ठीक है? It can take 1 hour. मजा आता है उसमें? मजा आता है, actually आता है. That's why I participated in the pageant ना. बहुत मजा आता है उसमें. But result क्या है?
Practical result.
Result are good photos. उसमें भी बहुत मजा आता है.
But I think if you're not looking fresh from within,
Yes, but if you are tired, कितना भी मस्कारा लगा लो, कितना भी फाउंडेशन लगा लो, you will not get the desired look. Desired look के लिए चाहिए diet and exercise. That is the base. जिसके ऊपर तुम फाउंडेशन लगाओगे, मस्कारा लगाओगे, जो भी लगाओगे, but the base should be ready. Your facial, the health of your face, skin, the glow, it all depends on diet, exercise and your life satisfaction. है ना? ठीक है? तो any other question?
For me, the problem is actually how to stay consistent. Like I will do it for a week, then I will give up.
That will motivate yourself again. The contrasting image you will see. ठीक है? These are the things that you have to do. इसमें कोई options नहीं है. These are mandatory things of life. है ना? How much extra we go and spend on selecting a good cloth or selecting a good makeup, वो सब that is for our own happiness, we'll do it. But ये सब चीजें option नहीं है. These are the mandatory things of life. You have to do it. है ना? जो तुम्हारा end goal है, to look good, to feel good, to be a better person, वो सारे चीजों के लिए you have to do this. There's no other. ठीक है? We'll end it here.
Thank you.